everybody. I think we're just going to go ahead and start. I'd like to introduce myself. I'm Barbara Derrick, and I'm the Interim Executive Director for Smoke Free SC. We're really happy that y'all joined us today for our Tobacco Partners Roundtable. We meet every fourth Friday of the month, and we've had some really great speakers. And today we're excited because we've got Jaron King from DHEC, who is going to present the Youth Tobacco Survey information from 2021. I did want to let everybody know that our previous roundtables are on our website now. Under the banner, it'll have Tobacco Roundtable, and it'll have when you click on that, it has a link to join our listserv, and then also all the previous Tobacco Roundtable recordings. There are about 5 of them previously, and we've had some really good speakers, so please go out there and view them if you weren't able to participate earlier. So I'm going to turn this over to Tara, who will introduce Jaron. Or tell us a little bit about what's happening.
Hey everyone, I'm Tara Bell, Program Coordinator for Smoke Free SC. I just shared the link to the previous roundtable recordings in the chat bar. We are doing some construction on our website currently, so you'll start to see some changes, and we'll make sure our URLs are correct from the edits and the copies that we're making of the different parts of the website. I know some of you, hopefully maybe this is your first roundtable that you have participated in, because I know the link was sent out to some different school systems who may have participated in the youth survey. If you would like to be regular attendees of our roundtable meeting, we would love to have you. As Barbara mentioned, you can sign up for the listserv and our e-newsletter on our website. And if you're signed up to either one of those, you'll get the invitation for our monthly meetings. Again, we're so happy that you're here. We look forward to our discussion today. Jaron's going to kick us off with the youth survey results. And then we also plan to have Beth Johnson from American Cancer Society Can Quit Action Network joining us at the end to share some updates on local work and some federal bans. So thanks for coming. And I will pass it over to Jaron to let him introduce himself and his topic.
Thank you, Tara, and thank you, Barbara. I don't want to undersell what we do here at DHEC, but I am probably most excited for Beth's presentation and to hear what's going on around the state. So like Tara and Barbara mentioned, my name is Jaron King. I am the Tobacco Surveillance Coordinator here with the Division of Tobacco Prevention and Control here at DHEC. And before we really get going, I just want to give a quick shout out and a thanks to everybody that helped us with this survey, which chances are if you're on this call, you probably helped us. It really is a collaborative effort. I want to especially thank the division staff who all helped in myriad ways to get this survey data, not just the survey created, but the data collected. Also thank all of our region staff that helped as well. And then every school and parent and student that participated, because it really, it's hard, right? It's hard to collect data. We did this during a pandemic, and really grateful for what we've learned from this. Just a little caveat too before we get going. So this is the 2021 South Carolina Youth Tobacco Survey. These are results from there. We've performed this survey multiple times in the past. And so this presentation, if it looks familiar to any of you that have been here, could have seen the 2019 survey results. It's kind of revamped from that, just so you know. So I guess just to get going, just a little background on our youth tobacco survey. So as a surveillance tool, the SCYTS, I'm sorry, I've just got the chat up just in case anybody needs anything while we're going. But it monitors youth access to tobacco products and key behaviors and attitudes toward tobacco. As an evaluation tool, the survey is intended to document the Division of Tobacco Prevention and Control's progress over time, to recognize groups at risk and to identify areas to strengthen the division's activities and strategies. So it was first conducted in 2005, which was the baseline for youth tobacco-related behaviors here in our state. And in 2021, our participation rate was 74%, the high school response rate was 85% roughly. And the student response rate, excuse me, was 85%. The high school response rate was 62%, which again, it's about what we tend to expect. And we're just grateful that this means that, in the grand scheme of things, that we have representative data that we feel confident is representative of regular high school students attending public school in the state. The Youth Tobacco Survey, it's a comprehensive survey designed to evaluate the prevalence of tobacco use, age of initiation, and access to tobacco products. It also includes data on knowledge and attitudes towards cessation and readiness to quit, mass media influences, and secondhand smoke and vapor exposure. The 2021 SCYTS used 104 questions, and we had a total, right here at the bottom, we had a total of just under 1,900 students from 36 high schools across the state complete the survey. And one exciting thing about our survey this year is we for the first time asked about e-cigarette quit intentions and quit experiences, which we'll get to, but obviously is an important topic for this demographic. Just a little bit more about the sample design. So it is a two-stage cluster sample design, which creates a representative sample of public high school students, grades 9 through 12. In the past, we have had the tobacco survey that's included middle school, but for the last 2 iterations, we, for various reasons, we weren't able to survey middle schools, but moving forward, we will. So all of that is just to say, we're looking at high school students right now, but this will come back a couple times throughout the presentation. The first stage of the sampling design is where schools are randomly selected. And then after that, we randomly select about 2 classes from each school to participate in the survey. So we do this to minimize classroom disruption. But there are obviously some caveats, some limitations to this data. One is that this data only applies to students who attended public high schools. So it's not representative of all persons in this age group. Granted, it's over 90% representative, but that's something that we definitely want to be sure to include here. It also doesn't include private or alternative schools, which would include school dropouts, homeschooled youth, or youth in correctional facilities and treatment centers. Students who miss school regularly may not be included in the sample, although we ask some EPI questions to get at that. SCYTS also provides little information on family socioeconomic status, and that's for logistical reasons, right? We usually can't ask a child what their household family income is, or other poverty-related questions. So that makes it difficult. And then the third kind of limitation is that this data is based on self-response, right? So it can lead to possible under or over reporting of behaviors due to social desirability bias and the like. But these limitations aside, you'll find that the SCYTS is the most reliable and up-to-date source of youth tobacco use information for South Carolina. We do have our full report is available on our DHEC website, and you can compare that across multiple years. We try to keep our reports very consistent so that you can really easily compare what you're looking at. And I also thought this is a great time just to bring up really quickly that we have a new comprehensive surveillance vendor, Research Triangle Institute. They'll be collecting data online for our YTS moving forward. And this, for obvious reasons, has a lot of benefits, but not the least of which is just the smaller lag between when we collect the data and when it will be available for public use. So that being said, this data that I'm going to share, that we will share, was collected beginning in the fall of 2021 and just up through mid-January 2022. That said, there shouldn't be that lag, waiting from January to the summer to release our data, because we won't have as much data processing to go through. But we were able to present some of our data here in this next slide. At the 2022 National Conference on Tobacco or Health. Barbara and Tara were able to join us there. And if anybody couldn't stop by our posters or wasn't able to make it that night, this is just one of our few posters that were presented where we discussed the differences between our 2019 and 2021 youth tobacco survey results. Here on the left, that table 1 is just describing the differences in our demographics between 2019 and 2021. And the overview is just that it's pretty similar, right? We are through the help of our vendor, we got a pretty representative sample and a sample that is pretty similar to what we've had in years past, which is what we were shooting for. And then over on the right, so we see 5 different tobacco products and their changes over time. I know this is way too much to go over and way too boring for me to just sit here and talk numbers to you. But it is encouraging. So we saw decreases in almost every tobacco product class among our youth from 2019 to 2021. Overall, it was about a 10% decrease in tobacco product use, which really encouragingly, there's a 33% reduction in cigarette use, about a 25% reduction in smokeless tobacco use, that's SLT, and then a 40% reduction in cigar use. So this is past 30 days, students that are reporting that they've used these products. And the only caveat, the only thing that we want to say that isn't as encouraging as we'd like to see is that there's only about a 4% reduction in e-cigarette use. So without that outlier, we'd see a much bigger overall reduction in tobacco use. But I'm going to just go through and talk about some highlights here as well. So again, only about 3% of high school students currently smoke cigarettes, which I say only just because that's with a historical lens, right? Knowing that we were over 20% this time around 20 years ago. So huge, huge gains, right? Huge public health gains in that time. And in parentheses, just so you know, those are the 95% confidence intervals. So we're 95% confident that the true percent of high school students who currently smoke cigarettes in South Carolina is somewhere between 2.2 and 4.4% of students, which again is great, but still, you know, if you have an average classroom of about 1 in 30, or of about 30 kids in a class, that means about one of those kids has smoked a cigarette in the last 30 days, which is a number that we all need to keep in the front of our minds. And again, it's about the same with cigar use, smokeless tobacco use, but the one that still jumps off the page in South Carolina is e-cigarette use. This is an outlier, just so you're aware, among other states across the nation. So most states saw a pretty big drop off during the pandemic of high school students reporting e-cigarette use. And we didn't see that huge decrease that we were hoping to see. So just something to make sure that again, we are aware of and keep in mind. And sorry if I'm going too slow, I'm keeping an eye on the time. Really quick, as far as access goes. So about a quarter of those students who used an e-cigarette in the last 30 days bought those from a gas station or convenience store. About 20% bought them from a vape shop, which was almost double how many bought them from a vape shop in 2019. There are a few reasons that we can go into on that, but I'm also really excited. We have a new youth prevention coordinator here within our division, and we'll be sure to be talking about that and working with her on novel interventions, because vape shops create just this totally different landscape, right? With loose regulations, but also we're all aware that they're ubiquitous now, and they're shops that didn't exist 5 to 6 or 7 years ago. So really interesting to see that a lot of current vapors are buying their own products despite being legally barred from doing so. And then social sources still represent the largest source of e-cigarettes. So again, it's just under 50% of current vapers are reporting that they're getting their e-cigarettes from a friend. And again, this is just for high school students. As far as secondhand smoke exposure, this is about what we've seen, the trends of what we've seen in the past, with about 20% of never smokers being exposed to secondhand smoke in their home. But a little up from that, 27.3% exposed in a vehicle. And then we do ask about strict strict smoke-free rules. So what we mean by that is that smoking isn't allowed in any circumstances in either at home or in vehicles. And that's that note there at the bottom. I did just want to point out before we go on and talk a little bit about this idea of e-cigarettes and youth use. So CDC Office on Smoking and Health, they have a really good infographic, and it's just a training slide deck that you can look up, but it's about classifying e-cigarettes and vaping products. One of the biggest things that I think for most of us, this just points out is that this industry innovates quite a bit, right? It changes quite a bit. And because of that, you can't necessarily assume that we, I don't know, that we're on top of, especially what youth are using. But you can see that there are a lot of different products that fall under these e-cigarette terms. Again, these are all self-reports, right? So if a student, it's very possible that they might use a product that they don't classify as an e-cigarette. So they might mark that, that they haven't used in the last 30 days. And obviously that throws off our numbers a bit. But if anyone's curious about any e-cigarette topics or anything like that, aside from trainings that our division's done in the past, there's a great deck here at the CDC Office on Smoking and Health there at that source that I'd recommend you just taking a look at. The biggest thing that I wanted to point out as we go forward is looking at some of these trends. So you can see here that despite gains in reducing cigarette smoking, which the Healthy People 2020 target was 16%. So we definitely met that of youth tobacco use. The total tobacco use is still pretty high, which is about 21%. So this is including, or I guess 24%, this is including e-cigarettes. One just quick note on this as we look at it, the Healthy People 2030 target, which is any tobacco use in adolescence, what they use as a baseline for that is inclusive of a middle school sample. And like I mentioned before, our middle school sample is always degrees lower than our high school sample. So what we would see is, or we can anticipate seeing, is that any tobacco, especially in the e-cigarette numbers and prevalences, would be quite a bit lower. So this is just something to keep in mind, that although it looks like we're very far off from our Healthy People 2030 goal, I don't think we're quite that far off because we just haven't had that middle school sample in the last 2 iterations. But it will be interesting to know, as Research Triangle Institute helps us with our next iteration, kind of where we land on that. But again, to me, the biggest thing that this graph shows is that we have made remarkable strides, honestly, not just in conventional cigarette use, but as we see that e-cigarette use among high school students stalling, and we do see, there's a lot to say about this idea between experimenters and established vapors and kind of where that goes in. But moving on from there, we also just wanted to share this new surveillance tool that Research Triangle Institute has developed for us. And this is the first time we've shared this publicly, but because it is proprietary, I'm just going to have some screenshots here. But we're happy to work with anyone who'd like to collaborate on using the data here that I present. We just can't provide public access to the dashboard itself. But in late 2021, we partnered with Research Triangle Institute to create a first of its kind tool to evaluate ENDS, which is electronic nicotine delivery system, advertising spending and social media presence. And the next few slides will describe some of the different components of this tool. But this is what the landing page looks like. And the biggest reason that we did this was because we recognized that as far as tobacco products go, ENDS were, again, a rapidly developing product class that we just didn't have the capability really to follow close enough. And they're a class that obviously between adults and youth, there's a different discussion to be had there, but the youth need no access to these products. So we look at this advertising, these advertising screenshots, and this shows total ENDS advertising by media channel. So the different channels that Kantar Media tracks, and you can see those over time. Again, a huge spike in the early days of the pandemic, mostly through magazines and television, and you see a lot of that tapering off. But you also see over here on the right, which is available to us through this RTI dashboard, is a map of the different buys. And again, most of those have been pretty small in South Carolina. The biggest that we see is a shared media market with Charlotte up in the Rock Hill area. So I'm sure Dr. Keeley would be interested to see that. But this is really just to show, and this is again, on the bottom left, this is national data, but then on that right, obviously, is local to South Carolina. And then they also have sales data. So one thing I did want to make sure that we were all aware of, you'll hear a lot in the national discussion that Juul is basically done. In South Carolina, that's not necessarily been the case. Again, half of South Carolina youth that report ever trying an e-cigarette have tried Juul. The way that our survey question, and again, this is something that we only realized once it came back, but the way it was asked, we wish it was asked, which products did you use in the last 30 days, but it's not. So all we can say is that Juul has at least been used by half of the ever e-cigarette users in our high school sample. But that said, Juul still sells quite a bit in South Carolina. Views Alto, it looks like, is the new market leader. But King Vape also has a product up there, Fume. And then down toward the bottom, you see Blue. These are it's really interesting because this captures, this is Nielsen data. And according to Nielsen, they expect that this captures, I believe it was 1/4 to 50% of all sales. So surprisingly, it doesn't capture vape shop sales, but it does capture things like convenience stores, bulk stores. So even despite not necessarily knowing if youth are the ones using these products, we can say that there was a certain amount of Views Alto, Juul, King Vape that was sold in the at least in that last fiscal quarter. Moving on, it was also really important to us to be able to couch this data against combustible sales, right? We know that ENDS are not, the focus in tobacco control obviously starts with cigarettes. And so we have an ability to sort by product type and to see sales data across cessation products, cigars, cigarettes, ENDS, roll your own and smokeless. Those are all different groupings that RTI has put together, but they are based on Nielsen scanner data. So cessation are over-the-counter cessation devices like lozenges, patches. But what we see here is not surprising to anyone is monthly dollar sales of cigarettes. And again, not surprising, you see Marlboro and Newport are the biggest sellers in our state. And it's really interesting too to see the cyclical trend, right? This is something that's been well established. We've known for decades about, when cigarette sales increase and decrease. But this is something that now we can actually see a little bit with ends as well. And I do have, I have the chat box up. I'm going to wait a second to go into those because it looks like Dan's answering some of them, but I will, yeah, we will look at that in just one second. I'm sorry. When it looks at our vaping dashboard also has the ability to look across social media and to look at Google Trends. I did want to highlight this really quick. So they can show us, Google Trends can show us maps of where certain products or certain search items are more prevalent. This one that I'm showing again is Juul. And the reason that this was interesting is that on June 23rd, 2022, that's when FDA announced that initial marketing denial order for Juul. So this is something that you could almost call it a red herring, because we're not sure, or we can't say that everyone searching for Juul at that time was interested in buying these products. I'm sure that there were researchers, there were reporters that were curious about the story. And the way Google Trends works, we just know that it's becoming prominent. And so that's where we really want to connect with our different research partners and see how we can tease out and really get meaningful data from this. If you notice there at the bottom too, this HQD is mentioned, and that's a Chinese disposable e-cigarette company. They started a USA brand right before the September 2020 PMTA deadline for e-cigarettes. So that's just something to know, especially as we go forward. They have a social media portal where we can look at both Twitter and Instagram and Reddit on the next one. But again, this is HQD associated handles. So these are some tweets from HQD up here in the top left, and some of their different Instagram posts. And these are updated regularly. But we can sort through by specific brands and specific influencers and handles. But then Reddit, I think, is really where we're really interested to see where this can go. And that's because there are a lot of reasons that people are using Reddit for e-cigarettes and for questions related to e-cigarettes. If I had just pulled this screenshot from top submissions in the last week, and you see that there are a number, one of them says vape shop folks, have you been visited by the FDA yet? One of them says explain like I'm 5 flavor bans. One of them says which bag can I put my e-cigarette in? And so there are some that are really focused on how we use certain how do we use certain products, right? But then there are also some that are really curious about like regulation and what's coming next. I wanted to show this example post too, because again, there are a lot of novel ideas we can think of with how to reach these people. This person posted, I'm currently aiming to finally quit altogether. For the last 7 years, I've been vaping with many different mods and tanks. And anyway, and this person goes on and talks about how they can ratchet down and deal with their nicotine. So Reddit is an interesting one for me because it obviously tells you a lot more than what Twitter and Instagram could tell you about what people are actually curious about when they're using these products. The idea being that we want to help as many people as can, make transitions away from nicotine and especially away from combustible products as possible. But as far as couching this in a youth tobacco survey, we want to make sure that youth just don't have access to these products in general. And I do want to note that this example post, it's not meant to be representative of the majority of the posts, but they're just what stood out to me as I made this presentation. The next thing that I just want to share really quickly, and this is because our wonderful communications and outreach manager is currently out, but these are some slides that she had put together in the past. They're just updated with 2021 data, but just to talk about how to use youth tobacco survey results in media relations in general. She wants to obviously highlight every time that before talking to anyone about your issue, you have to decide what your communication goal is. So you decide who your target audience is, the best way to reach them. Is that to reach out to a spokesperson and then provide different talking points. Kathy says that she encourages you to do the exercise and worksheets in this guide to get your communications plans finalized. And she has a quarterly, what's she calling it? A quarterly newsletter or board that she sends out that I know she'd be happy to include you on, but it just talks through many of the different items that she sees related to media relations and the youth tobacco survey, or excuse me, and tobacco data in general. Obviously, I'm focused right now on the youth tobacco survey, but some examples that she likes to point out are things about our different talking points. So things like about 1 in 4 high school students in South Carolina currently uses some form of tobacco. Since 2019, about 1 in 5 high school students in South Carolina have used an e-cigarette in the past 30 days. And then over 60% of students who currently use e-cigarettes tried to quit in the last 12 months. This is a big one and a new one that we can actually report on now because we have, and thank you, Sharon, it's called the Quarterly Resource Board, because we have that e-cigarette quitting data now. And then the other thing, there are going to be different print and especially social media ways to cite this. And these are just a couple examples that that Kathy Warner puts here for print and different ways that she would properly cite the SCYTS. And then I think we just have 2 more slides real quick, and then we'll jump into questions. Interviews in social media, same story. And again, these slides will be available. The last thing that we wanted to just highlight is that the YTS isn't the end all be all of South Carolina youth tobacco data. And there is what's called the Communities That Care survey. It's by the South Carolina Department of Alcohol and Other Drug Abuse Services, DHEC. They conduct this this convenience sample, this non-probability sample, and it's in 32 counties in South Carolina. This was the most recent one, had 89 items, and about 10 of those were tobacco specific. That said, there's no real landing page for this DHEC request. I also know that they've had some agency turnover, and specifically the individuals that ran the Communities That Care survey was changed. They moved on to a different employment, and so because of that, there might be a lag in getting some of that data. But if you're curious in the Communities That Care data, which again can probably get you more granular county data, please reach out to us and we can help you navigate that. Moving forward, we're hoping that our and planning to have more granular data on our youth tobacco survey from RTI, again, our new vendor. But we're just going to have to see how that plays out over the next few weeks and months to see where we go from there. But this was the 2021 data, really preliminary. Again, it's all online. All of the reports are. if you need the data yourself, reach out to us and we can help you get a data request form. But that is, that's the majority of my slides. And I know Dr. Kilpatrick is on. He was kind enough to join us even while he's on vacation. But rather than just having this slide up, I can stop sharing and we can, I can try to work through any of these outstanding questions. Let's see.
Jaron, I'll share something that Mike had put in the chat related to, let's see, I made a note of it rather than scrolling through the chat. First off, it's great that the quarterly resource board resource was shared, as a lot of people are requesting to sign up for that. So that's wonderful. Question from Dr. Cummings was whether or not we have data on percentage purchasing tobacco products and percentage daily or percentage regular use out of 20 out of 30 days. And my response to him was that we do have those figures to some degree. It will take a tad bit of coding and then seeing what the data actually shows, as there may be limitations to reporting it. But do you have any additional comments to that for purchasing tobacco products, like prevalence of that? And Mike, if you want to elaborate on that, if it's from what sources are purchasing, from where, if that's of interest, we certainly do have some questions in those areas that we can get.
Yeah, I'll just jump in real quick. And I appreciate that, Mike. This is definitely a missed opportunity to have not shared some of those numbers. Without going into the nitty gritty, we had a delay in some of our statistical capabilities due to expiring licenses. And Dan's smiling. It wasn't a smiling matter, but but luckily we should be on the up and up there. But that said, some of the post hoc work that I had done had showed similar to what we were talking about, that this idea between established and experimenting vapors is pretty prevalent. We also want to make sure that we're looking at how addictive, right? So if students are reporting that they used once in the last 30 days, but not 20 out of the last 30 days, then we definitely want to weigh that. So I appreciate that, and a missed opportunity to not have shared that data. But we do have it. As far as looking at where these students reported purchasing or obtaining those products broken down by heavy or established vaping and experimenting, I think that's really important. And I hadn't come across that as a distinguisher. So I'm gonna make a note to go in to look at that as well. I also noticed a little bit later, Dr. Cummings mentioned something about Cannabis Co-Use. We will run that. We had already run a study that looked at 2017 and 2019. So we'll include 2021 with that. One just note, so that everyone here is aware, THC is the question that we ask about quite a bit, but they're also, because CBD is quote unquote legal, there are quite a few outlets that try to market CBD products as well, claiming that they have no THC. That said, we want to start asking about that as well. And this just goes to the point that I'm so grateful for Dr. Kilpatrick's leadership in helping us to secure this online vendor, because RTI and doing it online should allow us to really be a lot more nimble. And so when things like that come up, right, using CBD versus THC in our question format, we can actually make that change in printing thousands and thousands of new surveys. So, but yeah, I'm taking notes right now just about some of those different analyses that we want to run, and I appreciate that. But hopefully some of that helped.
Jaron, one other question that Tara and Dr. Keeley were discussing was the limitations of the Kantar data and Nielsen, and where we can get purchasing data from. To confirm, Nielsen does include pharmacies and grocery stores. Is that correct? I thought it did as well.
Yes.
And then the online sources for various products, right? I even think Dr. Cummings made a comment that some of their studies had found that online purchasing was one of the great sources, especially for youth access. So, yeah, but a limitation, how do we find some sort of surveillance of monitoring online purchases? That's a discussion item, I believe. I don't know if you have anything to weigh in on that, other than it's exploratory.
Yeah, the only thought, two things come to mind. One of them is, I believe it was December of 2021, the US Postal Service said they will not ship e-cigarette products. They won't ship, they included that with tobacco products, saying that they won't. How closely that's followed or adhered to, again, beats me, right? How do they know? But even beyond that, it's also important to remember that one of the things I really like about the vaping dashboard is that we don't just, like with the social media, for instance, we're not just looking at South Carolina, we're looking at what youth see anywhere, which might be a lot of California, it might be a lot of other places in the States and internationally. But because of that, again, that's an inherent limitation, things like online sales. So, but Dr. Keeley's right. We don't have a great handle on where those sales might be. The other thing that is just inherently tricky, which I've always thought was interesting, is we do report a lot on where kids are able to kind of skirt the system, right, and get access to tobacco products. But it's been pretty clear through our data that that kids' greatest access to tobacco products is through someone they know, right? They're not necessarily buying all these products. And so because of that, it's just an inherent limitation in looking at sales data, because again, the majority of these sales aren't going to people that aren't supposed to be using, but it's that second and third hand source that eventually it's, so we're looking at kind of a supply chain issue there, and where that is. But yeah, I hope that helps as well. But thank you, Tara and Dr. Keeley, for bringing that up.
I know from personal experience that Snapchat and Instagram were the way that most of my kids' friends found their product. And it was almost like making a drug deal. They would, plan to meet in a park somewhere to hand over $5 to get whatever they wanted. So it's kind of frightening. Does anybody else want to unmute and ask questions of Jaron and Dan? Or comment? Thank you guys so much. We really appreciate it. It was a great presentation. Jaron, I will, if we get any questions, I'll forward them to you. It was a really great presentation. Thank you so much.
Hey, Barbara, this is Dave Keeley. I was trying to type it in the chat, but are there any surveillance data surrogates, measures that exist or that they either Dan or is aware of, that could tell us, at least in a ballpark manner, about online sales to underage youth?
I'm not aware of that, Dr. Keeley. Sounds like Mike has some studies in that area. I'm not sure if that's South Carolina specific or even domestic. Yeah. And some literature we can point to. Thank you, Jaron. I suggest we can dig in. We've got access to good literature from DHEC perspective and from University of South Carolina. Mike, if you've got some studies you can share, it sounds like Dr. Keeley's interested in some figures. Yep.
Yeah, that'd be great.
Yeah. I'm not sure what Deotis has with their communities that care survey, or even youth risk behavior surveillance system, RBS, and that's run by Department of Education. I'm 95% sure that they're not asking about where kids are getting their or how many are getting online purchases, but as you know, YTS seems to delve into those issues a bit more than those other surveillance systems. But it's certainly something that we will put on YTS next iteration, as it's and as Jaron mentioned, not just ever use where you purchased from, but within the past 30 days. And then we can cross-tabulate by those heavy and fewer product users by frequency. Yeah, so very informative for us from, improving our own questions, the way that we ask them. Thank you, Dr. Keeley. And Jaron, I don't know if you have anything to add to that.
I don't. Just want to thank again Dr. Kilbrachik, who is our surveillance. I didn't introduce you either. He's our surveillance evaluation director. We work hand in hand with both he and our division director, Sharon Biggers, and just really grateful for, again, the state effort to better understand tobacco use in South Carolina. Tobacco continues to be the leading cause of preventable death and disease, and it's pretty remarkable, though, that we're able to do what we can to extinguish that flame. So I appreciate it.
And just some closing comments from my end. When I started this position in 2012, I've been here over 10 years. Cigarette smoking was over 15% at that point. So that's a 300% decrease, 300 to 500% decrease in current cigarette smoking amongst high school youth since 2012, since a decade ago. So really good epi and health outcomes that are associated with that long term that we know for sure with cigarette consumption. So we're really excited about that. But we also understand there's a new landscape out there with other products. So a lot more to be done, and why we do this surveillance as a function, a core function of public health, that we invest into this, both blood, sweat, tears, and money to do this work. And so we appreciate every partner of ours and everyone's interest, and excited to be able to share this data. And we should have adult tobacco survey data in our hands soon that we look forward to providing some additional analyses and presentation on another webinar. And if anyone is interested in those health outcomes, whether it's our youth tobacco survey or adult tobacco survey, or even our vaping dashboard, we have interest in those from a study perspective. We have questions related to how many school days did you miss, and can associate those with their statistical significance with tobacco consumption. So if you're interested in those, we can bring you into those analyses and as well and share that. So thank you, everyone, for your participation today.
Thank you. Thank you both. That was a great presentation and we appreciate it. I'm not sure, but Beth did not sign on, so I'm assuming we're not going to have a presentation from her today, but I'm sure she'll be at the next meeting. And we will have another roundtable on the 4th Friday of August. We are confirming our speaker this week, and we'll get back with you and let you know. Does anybody have any general updates on what they're working on that they'd like to share with the group? Now's the time. Philip, you want to tell everybody about your Greenville news insert?
Oh, yes. So as we continue our work here in Greenville, we have the Greenville Journal, which is an independent publication that is distributed to zip codes of influence, financial influence in Greenville County. And so they distribute, I think, 25,000, and then they have the e-blast. But we did our airpreserve.org sticker on the front of all of those. And then on the inside, we have a half-page ad promoting our airpreserve.org. And for those of you not familiar with that, that is our policy work that we're doing with municipalities in Greenville County to get them to adopt smoke-free ordinances. When we grow up, we want to be like Dr. Keeley and what he's doing in the Rock Hill area. And so it's going to take us a while, Dr. Keeley. I don't know if we're going to get there anytime soon, but we want to replicate what you're doing there. And we appreciate everybody's support for that. We do have a series of ads that will be going in different publications between now and end of the year related to our airpreserve.org. So go to our website, airpreserve.org, and sign up, and we will continue to educate the Greenville County about the efforts we're doing. Thank you, Barbara.
I won't put anybody else on the spot.
Well, hey, Barbara. Yeah, Phil, thank you. We're in this together. I did want to ask the group, is anybody, cross-cutting with underage tobacco, nicotine product use, is the behavioral health, stress and anxiety that's and I'm wondering whether we have the behavioral health folks, whether they have any data or whether there's anything in the DHEC data that asks kind of side questions about anxiety or depressive, indicators, because I think there was some studies that came out during the heat of the pandemic that talked about this, that young people were self-medicating with nicotine products. Anybody have any comments on that? Anybody working with their behavioral health local folks, or know of anything at the state level where kind of drawing those cross ties between behavioral health and tobacco?
So this is Pam. I'll go ahead and jump in here. I don't see any of my DHEC friends on the line. So what I know is every year, DHEC has recently done their Communities That Care survey.
Right.
And it was done, I believe, back in February, March. The results are continuing to come in. Of course, they've been doing this for a long time. It's good longitudinal data for the counties and districts who participate, and certainly not all do. There are definitely questions on there about, tobacco, nicotine, different kinds of drugs, drugs in schools, et cetera, et cetera. I really encourage them to put some stuff on with exactly what you're saying. And I don't think it went on there. Basically, they're like, this is out of our scope. We really don't know what we would do with it anyway if we collected this data. I mean, that kind of thing. And this was not what the superintendent, agreed to do. It was all around alcohol and drugs. So having said that, though, I am now curious to go back and look at that survey to see if there's anything that might be related to what you're talking about. And I'm happy to do that if anybody else on the line wants to also, that's fine. But that's my input on that.
Great. Yeah, if you can email me, with anything that you discover, let me know. That it's particularly related to that Communities That Care survey.
This is Eve Fields. I'm with the Department of Mental Health, and for the last several months, we have had an increasing focus on tobacco use disorders in our population. and have been looking at the rates of tobacco use diagnoses and trying to improve those diagnoses so that we can do a better job of making referrals to treatment. I don't know that that quite captures what you're looking at in terms of a total survey, but we're also, and I saw Katie Wynn is on the line, working with DHEC and DHEC to develop some toolkits specifically for our providers to help them get patients have better access to tobacco and cessation resources and training to do that, because we know that, you know, people with mental health issues are much more likely to smoke than the general population.
Okay, well, that's helpful. You know, at the local level, in York County, you know, we want to have continue this conversation, and, you know, we get a lot of inquiries from parents with one of our agencies about what to do and what to watch for and stuff like that. So this data would be, and then I see where Mike put in there some studies I could look up. So we'll take action on that. But anything else that you come across, send it my way, please.
Jaron, did you want to say something? I saw your hand raised.
Yeah, thank you. Thanks, Barbara, and thanks, Dr. Keeley. I just wanted to highlight, Dan had mentioned this, because we have such a long survey, again, we try not to add too much, but right at the end, we added an epi question that asks, it's just a yes, no, because of a physical, mental, or emotional condition, do you have serious difficulty concentrating, remembering, or making decisions? That's an important one that we're interested in looking at, not just across tobacco use overall, but against product type. But then I believe, and I didn't see, I lost it, but Dr. Cummings had also asked about, I had filtered it in my own head about something about, you know, a profile of different tobacco users. And we are working on that with our vendor Rescue. They're still in the process of looking at the data there, but we look at audience segmentation and are looking at, you know, peer crowds and groups of kids that identify themselves, right? They self-identify and create these groups. And then we want to see, you know, what the characteristics are, and especially the values are, the self-reported values are of those students and their tobacco product use. So we'll be sure to share that. And in fact, I think it'd be really interesting if we reached out to them, maybe even Barbara, if we could bother you for one more of these roundtables, just to have them share some of those findings, because again, it's really interesting and eye-opening to see, you know, what is similar across these different peer groups of kids that are using different tobacco products.
No, that'd be great. I will definitely get on that. I'll reach out to you, Jaron. I think Mike's question was, what are the characteristics? How did the characteristics of a vapor, somebody who vapes, differ from cigarettes? Was that it? Yeah. All righty, guys. Well, we're running over a few minutes. Is there anybody else who'd like to say anything?
I just want to say kudos to Jaron for
Definitely
his presentation today, and you can hear in his voice, he's not feeling the greatest today. So thank you, Jaron, so much.
Yes, thank you, Jaron. Again, it's a great presentation. Dr. Keeley, I will, well, Tara, I'm going to ask you to save the chat so that we can include that out there on for everybody to see on we'll put the slides, that's okay, Jaron, right? You said you could share the slides. We'll put the slides, the chat, and the video out on our website under Tobacco Roundtables, okay? All right, thank you guys so much. Again, thank you, Jaron, Dan, everybody for contributing. It was a great presentation. Thank you.